Good day, everyone. I am Risha Ethel Berondo, and today I am going to discuss one of the infectious diseases of the nervous system, which is the encephalitis. So, what is encephalitis? Encephalitis is an inflammation or swelling of the brain tissue. There are several causes, but the most common is a viral infection. In rare cases, it can be caused by bacteria or even fungi. Encephalitis is a rare yet serious disease that can be life-threatening. This leads to changes in neurological functions, and it can result in mental confusion and seizures. There are two main classifications of encephalitis, namely the primary encephalitis and the secondary or post-infectious encephalitis. The primary encephalitis is a condition that occurs when a virus or other agent directly infects the brain. While on the other hand, the secondary encephalitis is a condition that results when an infection starts elsewhere in the body and then travels to the brain. There are also different types of encephalitis and they have different causes. An example of this is the Japanese encephalitis, which is spread by mosquitoes, the tick-borne encephalitis that is spread by ticks, and rabies that can be spread through a bite from a mammal. So what causes encephalitis? The cause of encephalitis depends on the season, the part of the country, and the type of exposure. But viruses are the leading causes of encephalitis. And these viruses are the herpes simplex virus, varicella zoster virus, and arboviruses. The herpes simplex virus, it typically travels through the nerve to the skin, where it causes a cold sore. In rare cases, however, the virus travels to the brain. This form of encephalitis usually affects the temporal lobe, the part of the brain that controls memory and speech. It can also affect the frontal lobe, the part of the brain that controls emotions and behavior. Encephalitis caused by herpes is dangerous and can lead to severe brain damage and death. Next, we have the varicella zoster virus, the second most frequent virus causing encephalitis or meningitis. It develops reactivation of latently persistent virus in the nerve ganglia after primary infection with chickenpox. Next, we have the arboviruses, in which it spreads by mosquitoes, ticks, and other insects, including Japanese encephalitis, West Nile encephalitis, and tick-borne encephalitis. Note also that encephalitis is more likely to affect children, older adults, and individuals with weakened immune system and people who live in areas where mosquitoes and ticks that spread specific viruses are common. So the symptoms for encephalitis is when the patient experience a fever, headache, and photophobia, or also known as the excessive sensitivity to light, and there may be also general weakness and seizures. We also have less symptoms and more serious cases. For less common symptoms, the individual may also experience knuckle rigidity or neck stiffness, which can lead to misdiagnosis of meningitis. There may be stiffness of the limbs, slow movements, and clumsiness, and the patient may also be drowsy and have a cough. And for more serious cases, the person may experience severe headaches, vomiting, confusion, disorientation, nausea, memory loss, speech problems, hearing problems, hallucinations, as well as seizures and possibly coma. In some cases, the patient can become aggressive. For the treatment or the patient care for encephalitis, we have the bed rest and breathing assistance, as well as careful monitoring of breathing and heart function, intravenous fluids to ensure proper hydration and levels of essential minerals, anti-inflammatory drugs such as corticosteroids to reduce swelling and pressure within the skull, and anticonvulsant medications such as phenytoin to stop or prevent seizures. Now, for the most common reservoir are the mosquitoes, ticks, and other infected mammals or insects. The mode of transmission for encephalitis is through contact with body fluids, person-to-person contact, or when an infected person's blood or body fluids are introduced into the bloodstream of a healthy person, from the bites of mosquitoes that picks up the virus from infected birds, chipmunks, squirrels, or other animals, and also it could be transmitted through bites from infected animals such as cats, dogs, and bats. Now for the laboratory diagnosis, we have MRI to scan for hyperintensity, restricted diffusion, hemorrhage, and other possible problems. Next is the lumbar puncture or the spinal tap to check for inspection in the brain or spinal cord. And the EEG or electroencephalogram to look for seizures or specific patterns of electrical activity in the brain. That's all. Thank you for watching. I hope you've learned something and God bless.